My approach was more of a foundational approach. So I wanted to create a platform that would really help the industry transform, help people that wouldn't want to use telehealth to actually get an introduction into it and want to use telehealth, want to use our platform and deliver telehealth.
My guest today is Dr. Sylvia Pfeiffer, the Director, CEO and Co-founder of CoView, a telehealth solution that helps clinicians set up video consultation services for their patients using WebRTC technology to make it really simple for patients to join and for clinicians to set up a new service. Welcome to Hacking Health. This podcast is for future-focused health experts, thought leaders and change makers who are interested in making health accessible for everyone, because together we can get to the future faster. Sylvia, what are you most excited about right now?
I am most excited about the new opportunities in unified patient communications that we have. So with the pandemic, we've seen a lot of uptake of digital technologies, particularly telehealth. And telehealth, video calls like this has been a very strong uptake, but we can now see interest beyond that with integrated phone calls, video calls, text chat, and all those what they call unified communications pieces. So I think that's making a big entrance into healthcare at the moment, and really is exciting for us.
That is so exciting, because I can't tell you the number of times I've gone to see a doctor and then come home and my husband said, "What did they say?" I'm like, "I don't really know. I didn't understand." So the ability to ask questions, could be a real game changer for patients in properly understanding their own health.
Absolutely. When you're at home and you're prepared for a video call or a phone call with your clinician, you probably you make notes and you're prepared, you've asked your questions beforehand. Whereas when you go into a doctor, you kind of go in and then you go, I've had this pain and that pain. And then you go out and afterwards you realize that you haven't actually asked all the questions you wanted to ask. Or gotten something, and it's always incomplete. At least that's my experience.
Yeah, well, that is exciting. To get personal quickly, can you tell me something about yourself that most people don't know?
Oh, sure. I've got a doctor in front of my name.
Yes.
But it's a PhD in computer science. It's not in the medical field. And I think that's probably something that a lot of people don't know. So I actually wrote the first version of CoView myself while I was working at the CSIRO. So that's one of those backgrounds. And I guess the other thing that people don't know is that I can't really see blood, at least when it's really gushing or something like that. So that's really the reason why I didn't go into the medical field. I wanted to become a practitioner. And then I went, all the way to the other end, became a technologist. And now this is me making it a unified round in my life. I'm going back to what I originally wanted to do, help people. And now I help people with technology, with their health.
Yes, with their health. So I was going to ask you what influenced you to get into the field, but I think that's also the answer to that question.
Yeah, absolutely. Look, it all started while I was at the CSIRO and I was working on new video conferencing technology, which would work in the browser and make things easier. And we saw applications in healthcare, and that was immediately fascinating to me. And that brought me into the field, that I could really connect the two ends of my interest, healthcare and technology, finally put them together and make a difference.
So you've worked for some pretty cool places. You mentioned the CSIRO, Mozilla and Google. What would you say the benefits were of working in those organizations?
Creating a startup can be quite a challenge. You start with a small group of people and you don't really know how to build the product, how to build the market, and how to build your team. So having worked in a larger organization like Google before, and also the CSIRO, I've seen larger organizations. I've seen how they operate, what kinds of policies they have in place, what kinds of processes, leave processes, and all sorts of things that need to be in place for it to make a fair work environment with rules that everyone knows what's going on, and can work around. And so, when you're small, it doesn't really matter. You can talk to each other and you figure out the policies, etc. But as you grow, you need to bring in these policies. You need to make more rules and you need to write it all down. So I knew where we had to go, and I didn't want to make it too much of a administrative overhead. So sometimes you can go too far, right? And it becomes really an administrative nightmare just to stick to the rules of the organization. And being able to challenge that and make the rules, but make it so that they support the work life rather than undermine it, and you end up just working on administrative stuff. That's a really important thing. And because I've worked at a government organization like CSIRO, I've seen how some things can be going overboard. And I've worked at an organization like Google, where they're trying to minimize all this administrative overhead. I could find the right pathway for us as an organization. The right balance.
We're doing some employment agreements for a new business at the moment, and the owner was suggesting to put so many things in the employment agreement. And so our suggestion with a lot of those was to put them in a policy, because policies can be changed and adapted as you grow. Whereas if you have it in the employment agreement, you bind yourself to something that might not be appropriate in a few years' time if the employee stays with you for the long term. So I can really identify with what you just said. What was
keep it simple.
Keep it simple.
It's
exactly.
always my approach, as simple as possible. And simplicity and keeping it simple is hard. It's really hard.
Yeah, definitely. Especially if you're working in an area where you're challenging the law or trying to figure out what the bounds of the law are in terms of the acceptability of what you're putting forward.
Indeed.
What would you say the biggest challenge that you found was when starting CoView?
Well, I guess the biggest challenge was really to get adoption, find a market that is willing to pay for the product that we're developing. We spent a lot of time and a lot of energy and really expensive, software engineering resources at building a really good platform for healthcare providers. But the market, the healthcare providers that we were selling to were often not quite that responsive or that interested in telehealth at the time. So it was really hard to convince the market to take up the product. And, then the pandemic came and basically everyone had to take it and take the jump. And we did not have to convince anybody anymore. It became just, the thing to do. And a lot of clinicians told us that they thought it was going to be hard, it wasn't going to be doable, it wasn't going to work. And then they did it through the pandemic. And we got so much feedback by people saying, this is so much easier than I thought it would be. It actually is a really nice extension to what I do, and it makes it much easier for our patients to get access to care. And for me, sometimes as well, because I, as a practitioner, I don't always want to see the patient at the same place. I might be en route, I might be traveling, I might need to stay in the hospital longer, and I can just take a call from there. It can be much more flexible, and technology really provides this flexibility for everybody.
So speaking of flexible, you work from home 7 days a week, not 5. And where do your team work from?
Yeah, we are a remote first company ourselves. So all our 55 staff work from home in the first instance. We do have 2 smaller offices, and they're in co-working spaces. One is in Sydney.
Yes.
That's a 6-people office, and one's in Brisbane, another 6-people office. But of course, we have many more staff than 6 people, both in Sydney and in Brisbane. There's about 25 in Sydney and about 20 in Brisbane. So this is for staff that just, sometimes when you're working from home all the time, you just like to get out and work from somewhere else. And so this is for staff to have that possibility to work from the office for a little time. It's also for teams that want to get together and do like workshops or something together where it's possible, because a lot of our teams are actually distributed across all of Australia.
Yes.
And we even have some staff in New Zealand and in the US. So we have the offices also for once a month, we try to get together all the people in that region. So everyone in Sydney once a month come to the office and work together. And that's to build a bit more of the social interactions between people, because otherwise it becomes too operational, so to speak. People just interact with each other for work purposes, and these human relations have a little bit of a problem. As much as we try, to build human relations over Slack, we have a channel where people share photos of their pets and all those kinds of things. So we build human relations where we can, but there's nothing better than getting together in person. And so once a month we try to do that. And then once a year, we have a company offsite where everyone comes together in the same place and we meet each other. So that's how we deal with that complicated situation of, allowing people to work from home, but at the same time, building a cohesive team, people that want to work with each other.
You also have a distributed team internationally and nationally. And in you talking about this, I realized as one of our lawyers that has worked with us for more than 2 years that I've never met in person. And we work together almost every day.
It happens, yes. And it's interesting that can work, right? Nowadays, it's almost, you see people on video calls all the time, but it's almost as good as being in person. The only difference is when you then actually meet them in person, you realize that they're not your height.
Yes.
Because you just assume they're the same height, but then you meet them and you're taller than I expected. Or
see like from a different angle how they look. That's so true. So I'm going to have to make it my mission to meet him next year, and we can actually be in the same place and have a cup of coffee or a meal together. Find out what else makes him tick. I was sending Christmas presents and I asked him if he preferred chocolate or wine. And he said, actually, I'm a vegan and I don't drink. And I was like, great, back to the drawing board. So I sent him cherries to hopefully he's not fructose intolerant. Otherwise, it's going to be a bad situation.
Yeah, so, these are the things you find out.
Yeah, these things you find out when you ask, actually. So what does health tech mean to you?
For me, it's the way in which the healthcare industry goes about digital transformation. So picking up technology in every aspect of our lives has happened, for the private person, but this hasn't really happened in healthcare yet. The pandemic gave that a big kick, so it's starting to happen more and more. But there's also business models that need to be created around those things. You can't just bring in a new mental health assessment application and it needs to undergo TGA approval because it deals with people, and then it needs to have a business model. So there need to be a reimbursement for it, or the doctors need to be prepared to pay for it, or the patients need to be prepared for it. So that whole space is in turmoil, and healthcare will take a much longer time to digitally transform than any other industry, simply because there's so many different complicated aspects involved. There's, Medicare, which is actually paying for a lot of things in healthcare, which is not the case for any other industry. You don't have the government paying for your cinema tickets or anything like that. It just doesn't happen. So healthcare is quite different. And because of that, and also because human lives are involved, right? Human lives, you try to keep things safe. And as you're trying to keep things safe, you're trying to make changes very, very slowly. And so everything in digital transformation in healthcare is going to take a long time. At the same time, it doesn't have to be glacial. So before the pandemic, it really, really was glacial because everyone was just saying, oh, let's not change this. Oh, let's not change this. This is half working. Let's keep that. And the pandemic has really challenged that and has allowed us to make a lot of changes that we wouldn't have otherwise been open to do. And so, it will take time. But health tech to me is the motor that will make that digital transformation possible. The inventions of new technology that people like, us, like CoView, like a lot of the founders in health tech, a lot of the clinicians that create new applications as well, companies that are involved in healthcare. There's lots of different inventions that are being made, and those inventions need to be picked up and market tested and then gone through TGA approval, etc. So, there's a lot of things that need to happen to make that whole digital transformation real. And we can have a vision of the future of healthcare with all the digital tools involved. But the steps to get there will take a while.
Yeah, I think you nailed it, because it's because of the regulation. Like, because of the regulation, it makes it so hard for people to even test things. Like,
That's
yeah,
why
there's
clinical
so
trials,
many bottlenecks, aren't there?
Yeah, clinical trials are really important in healthcare, and that applies to health tech. And people haven't really realized that yet. A mobile application that gets introduced, anybody can write a mobile application. If you go to an Android or a Apple App Store, you'll find a million applications that will help with mental health. Which one do you pick? Which one do you trust? Which one will actually work? And so that's what clinical trials are for, to make sure to identify those that work. And once they work, which ones do get reimbursement? It's a bit like, the drugs, when drugs get developed.
Yeah, same process.
All of that process is very, very important to go through and make sure that these things that come out will be safe to take and will actually have an impact. And so digital apps, the whole space of digital therapeutics, as it's called, is going down that same pathway. And we're very much at the beginning of that. There are no more reimbursements in Australia for mobile apps. And a mobile app can be just as effective as a drug. So it should eventually become part of what we reimburse.
Yes.
But we haven't gone down that track in Australia yet.
So speaking
in other countries, we have.
Really?
Yeah, in other countries we have. Yeah, Europe has digital therapeutics reimbursement. America has apps that they are reimbursing for. We're a little bit behind on that, but it's something that I've been pointing out and pushing for a while.
Good. In your lobbying job.
Well, podcast like this is a way to lobby as well, to make people aware that these things exist and that there is a necessity for change.
Yeah, definitely. I never thought of that like that. So speaking of apps, what is an indispensable tool that you use in your role? Not Zoom.
We use a lot of tools, but Zoom we don't use because we've got our own application.
Oh, yes, of course.
So we built the CoView application, yes. But I'd say because we're a remote-first company, indispensable for us is Slack, actually. Everything happens around Slack for us. Slack and email. So Google, we use Gmail.
Yes.
We use Google Drive for sharing our documents, and we use Confluence as a company knowledge repository. So all of those tools together, they really make it possible for us to work as an organization. But all communications revolve around Slack.
What are some of the common myths about health tech?
I think one of the biggest myths that I would identify is that older people don't use technology. That's a big red herring that gets often used to say, oh, I can't use this in my residential aged care facility. Our people don't know how to use tech. That's a general statement that just isn't true anymore. Surely, of course, there are people that can't use technology, maybe because of a disability or something like that. But honestly, the majority of older people have picked up technology, have a phone, have an iPad, talk with their family over video calls regularly. They have started understanding technology, and it's just a myth. And in a similar vein, a lot of clinicians actually say, oh, my patients don't understand technology and I don't need to do this. I don't need to pick up technology and I don't need to use health tech with them because they don't understand it. It's a generalization that's just wrong.
Yeah.
And generalizations are often wrong because, you cut everyone across the same comb and it simply is not true. There will be some, but the number of people that have never had anything to do with technology is getting smaller and smaller every day.
So true. My dad, who's in his 70s, is a lot better at a lot of tech stuff than I am. I can often get him to help me with it. So It's
That's
just
cool.
very person specific, isn't it?
Very much, very much.
What's one question you get asked too often?
One question that gets asked very often is, have we stopped using telehealth after the pandemic?
Yes.
And I sort of go, why would you ask that? I mean, people have digitally transformed, and
Yes.
they have picked it up, and it's getting used every single day. Telehealth has become part of every day's work for a lot of practitioners in Australia, and it hasn't stopped. It won't stop. It will continue growing. Of course, during the pandemic, every single one did telehealth all the time. So that isn't quite the case anymore, and the usage has come down. But since last year, the usage has been growing again, and people are really thinking about how they can make better use of telehealth quite generally. You know, how they can integrate it into their workflows. How they can encourage their patients to use it. So there's a lot of thought that has to go into that, what I still call the digital transformation, and telehealth is still part of it. While it was all the barriers were removed during the pandemic and everyone just did it.
Yes.
But then now we're going back to a more considered approach to it, and the digital pathways that are being used, or the patient pathways that are being used, all have to be adjusted to include telehealth. And so while all of that change is now happening, it's going to still take a while before every single clinician knows how best to use telehealth in their day-to-day work.
Yeah, I am, as a patient, 100% willing to pay more to not have to go and see a doctor in person if it's not really necessary, because of the time in travel, because of the time in the waiting room, because of the time around sick people. You know, there's so many reasons to keep doing it. And I'm so excited about what you've created. What is a productivity hack that you have for entrepreneurs? Do you believe in these things?
Sure. There's a lot of things that you can do to be more productive. But one thing I think is very important, and we try to do this all the time: test your ideas before you start hiring a large development team and implementing things. So test them with customers. Talk with the people that you're trying to sell to, and maybe build a very crude, just a paper-based or a digital mock-up of what you're trying to do, and put that in front of people before you invest a lot of money into actually building it. Because if you're building it and you afterwards realizing it should have been done differently, it's much, much harder to go and change it than it is if you've done all your research beforehand. So I'd say that's a productivity hack.
That is a great productivity hack. What do you wish that you'd known when you started? Maybe that's the same answer.
So that productivity hack that I just said only works in limited ways for telehealth.
Yes.
Because, you actually have to be able to have a video call before you can experiment on things.
Yes.
But we always try to put the least amount of effort into building a new feature, so we can learn from that new feature as we get it into people's hands, and learn and get the feedback from our customers, and then improve on that. So that's sort of our approach to following that productivity hack. If I had known there was going to be a pandemic, I think I would have been able to raise more money beforehand.
Yes. The thing about these things is you don't get advance notice, do you? That is, no. I'm sure that would have definitely been the case. A lot of people would have been much better prepared, including you.
Absolutely.
What is your ultimate goal?
Our ultimate goal with CoView is to really encourage that digital transformation of the whole industry. So we could have just created a company, hired some clinicians, and offered telehealth ourselves, which is what some other companies are doing in telehealth, and a large amount of companies, and we need those as well. But my approach was more of a foundational approach. So I wanted to create a platform that would really help the industry transform, help people that wouldn't want to use telehealth to actually get an introduction to it, and want to use telehealth, want to use our platform and deliver telehealth, because we think that a large part of why clinicians are not picking up telehealth is because they think they can't deliver the same quality of care via video as they can in person. And so we're continuously striving to build a better platform to give them that confidence, to give them the capabilities in the platform to deliver at the top of their license, deliver the best possible care within the restrictions that a remote care solution provides. So we're continuously addressing any limitations and problems that our customers find and removing any obstacles to make it as much fluid as possible.
Love it. Thank you so much for meeting with me today.
Pleasure. Thanks for having me.
We're going to keep the conversation going in our private Facebook group, You Legal for Doctors. You're welcome to join us there.